Hi there, I'm Dr. Jim with Phoenix Heights Veterinary Hospital, and today we're going to answer some questions about feline or cat dental disease.
Dr. Jim, why is dental care important for my cat?
It's important for your cat just like it's important for us. The teeth are used for chewing, and if they get disease, they can cause pain and discomfort, and if teeth are allowed to rot or decay to a certain point, then they can start to affect other parts of the body like the kidneys and the heart valves and things like that. So again, it's important for us. We brush our teeth every day, or most of us do. With cats, that can be sometimes a bit of a challenge, but again, they develop, tartar and gingivitis and other anomalies, and so they require dental care too.
How often should I brush my cat's teeth?
Well, if you can do your cat's teeth, and I will be honest, my cat is not a fan of it, but if you can, I encourage it at least once a week. Generally, what we try and tell people is there are 6 arcades, the top and the bottom on each side, and then the front too. And we try and have you brush those sections about 10 seconds each, and you move around, and then it takes you roughly about a minute to do the whole mouth. You don't do the flat surfaces, and you don't do the inside surfaces. You don't want to get you don't want to get bit, and your cat won't like it if you do.
What type of toothbrush and toothpaste should I use for my cat?
There are feline toothpastes that are available, and those are probably more palatable and so forth. And you can also buy feline toothbrushes, but you can also buy a soft bristle pediatric brush, and that will do just as well. Sometimes some of the commercial feline brushes I found are a little bit soft for what we need, but you don't want something that's medium or hard like for us. That's just too much. Your cat's mouth is delicate, and you got to treat it as such.
What are the signs of dental problems in cats?
Sometimes there are none. Other times there are symptoms of bad breath, drooling. Sometimes you might see that your cat is reluctant to chew on one side, might drop hard food. Other times, sometimes owners will come in and they're not aware that there were any issues, and we'll show them that the gums are red or angry, and they're like, wow, I never noticed that.
What are the common dental diseases in cats?
Probably gingivitis, periodontitis, which is loosening or a decay of the periodontal ligament. That's like little strands of fiber that hold the tooth into the gum. And then cats have a tendency to get what we call odontoblastic resorptive lesions, which we call cavities. And it's not because your cat's eating a Snickers bar. It just is. It's a genetic and an immune-mediated issue. And so they tend to lose sometimes the crowns on the top of their teeth because of the cavities that develop.
How often should I have my cat's teeth professionally cleaned?
Kind of varies from cat to cat. Some cats will develop things where they need care every 6 months. Some cats may need dental cleaning once every 3 years. So it varies depending on the bacteria in the mouth and the saliva composition, what they eat, how much they chew. So there's not a hard and fast rule, but it kind of gives you a guide, somewhere between every 6 months to every 3 years.
Can my cat's diet affect their dental health?
Absolutely. Obviously, if you're feeding something that's lesser in quality, certainly you can have more buildup. Sometimes canned foods for some cats can cause more buildup. That's not always the case. The harder foods tend to have a little bit more of a scraping ability, but again, sometimes it comes down to genetics and the composition of the saliva and the bacteria that are present, and sometimes it has nothing to do with what you're feeding whatsoever.
What should I expect during a professional dental cleaning for my cat?
Well, your cat's going to be anesthetized. They don't like to say ah, so they will be here for a few hours. If they're old enough, they're going to have some blood work, an IV catheter placed, some IV fluids run, connected to monitors. And we're going to scale the teeth. That means remove the tartar. That's the stuff that you can see visually. Sometimes it's kind of a gray-brown color. And then we'll polish those teeth, because when we clean them, we make little imperfections that we want to smooth out. And of course, during that procedure, we're going to look for issues like cavities or decay. And a lot of times we end up putting fluoride on. Just like for us, it will strengthen the enamel and slow down periodontitis and cavity development.
How are cavities then treated?
Unfortunately, for most cats, it generally means extraction of the tooth. There were, in the earlier times, we would try and fill those. Unfortunately, those fillings just don't hold up, and we found that the decay would continue despite what we had done. So generally, if we find a cavity, it's just best to remove it and let things heal, and we're good. So I hope you find that information helpful. If you have more questions, please give us a call, 402-489-0501. Thank you and have a good day.